Hello, CDHA members. We're excited to share with you today our poster on the effect of sodium hypochlorite pre-rinse on caries susceptibility testing. My name is Sam, and I'll be joined today by Andrea, by Gabe, and Dustin. So we know that the COVID-19 virus has been transmitted through aerosols and droplets, and this has been a big concern in the dental community. The American Dental Association and the Center for Disease Control have both requested that a pre-rinse be used prior to all dental procedures. A pre-rinse has a common antimicrobial agent in it, and some of these antimicrobial agents are things like chlorhexidine, hydrogen peroxide, sodium hypochlorite, and essential oils. There is strong evidence that a pre-rinse, antimicrobial pre-rinse, has an effect on reducing bacterial load. There is, however, little to no evidence that it reduces the viral load. There is also a lack of information on whether or not a pre-rinse should be used in caution when using things like a caries susceptibility test. The objective of our clinical study was to evaluate if the sodium hypochlorite had an effect on ATP levels in the mouth. We hypothesized that the pre-rinse would have an effect on the ATP testing. This study has a practical significance because this may provide evidence and a change to how we change clinical procedures in the dental practice.
The study was approved by the Institutional Review Board. We have a flowchart of our procedures. Upon IRB approval, we recruited 12 individuals for our study and received our baseline readings on our first day. 24 hours later, we conducted the same readings, but with a pre-rinse, and laid out our results and analyzed our data. We have our inclusion and exclusion criteria listed here. The first day, when we received our baseline readings, we had one examiner perform the swab test on the lingual surfaces from canine to canine in the mandibular quadrants. Each patient returned the following day and performed the exact same test, but with a pre-rinse for 60 seconds. Our statistical analysis was used with G-Power, and we had a paired sample t-test.
We had a total of 12 subjects that participated in our clinical trial. The age range was 20 to 29 years old with a mean age of 26. The ATP reading interpretation is as follows, range between 1 and 9,999. 1,500 or below is considered a low caries risk, whereas anything above 1,500 is considered a high caries risk. In table 1, there's a descriptive summary of our day 1 and day 2 pre-rinse ATP readings. With day 1, the mean is 3,999, and day 2, 6,710. These numbers are also illustrated in figure 1 with the line plot that shows a large leap from day 1 to day 2. There was a statistically significant difference between day 1 and day 2. There was an increase with the use of the pre-rinse.
Dental caries is a multifactorial disease that involves many complex risks and protective factors. Here at our institution, we perform a caries risk susceptibility test at every comprehensive oral examination to measure the levels of ATP in plaque biofilm. Using luciferin and luciferase enzyme, it breaks down ATP so then we can quantitatively determine the amount of bacterial numbers. Bacteria is broken down into bioluminescent visible light at 560 nanometers. It is strongly correlated that ATP bioluminescent light has a relationship with oral bacteria and oral streptococci. Based on our results, our hypothesis is accepted because there was a significant change in ATP readings with sodium hypochlorite pre-rinse. However, it is important to note that the ATP reading interpretation did not change. Our study prompts to reevaluate the use of pre-rinse for diagnostic caries risk assessments. COVID-19 has mandated many changes in clinic protocols, and the pre-rinse is an example of this. Our results are highly significant, and it is important to evaluate the impact of clinical protocol changes. Some of the major limitations in our study include our sample size and the fact that the baseline readings were not categorized, since both readings were considered to be high-risk caries. Additionally, we only used sodium chloride rinse, and we didn't use other rinses, other antimicrobial agent rinses. Thank you very much for your attention, and we look forward to seeing you at CDHA.